Hey guys, I'm Tara. Welcome back to my channel. Today we're going to do a different type of video, so we're going to kind of sit down and talk, and I'm going to teach you guys what the pelvic floor is. So I'm a physical therapist and I specialize in pelvic health, and through my clinical practice, it's so common that I'll hear patients come in and they'll be coming to me for something going on with their pelvic floor, and they'll be like, oh, my doctor said I have an issue with my pelvic floor, that I need to come see you, and they have like no idea what the pelvic floor is. So with this video, I just wanted to bring awareness to what the pelvic floor actually is. And I think that the more you understand your body, the more in tune you are to things that are going on with your body. So it really is important to have this basic understanding. So I know if you're someone who has been told maybe that you have an issue with your pelvic floor, that it could sound super scary and foreign and like, what is that? But really the pelvic floor is just a group of muscles. Like any other muscle in our body, it functions in the same way. So it's really less scary than it sounds. They are definitely very important muscles and we want to keep them healthy, but I just wanted to kind of take that fear out of the thought if you have heard that you have an issue with your pelvic floor. It's still a muscle issue. So basically what these muscles are doing is they kind of create a sling. So they attach to our pubic bone, so that's in the front, and then our tailbone, our coccyx. So they're attaching there and they make this sling. The point of this sling is to support our organs. That's the main function. So in women, it's going to support our bladder, our uterus, and the rectum. In men, it supports the bladder, prostate, and the rectum. So men, you do have a pelvic floor. It's very similar to the pelvic floor in females. And don't let anyone tell you otherwise, because I really will see male patients come in and they'll be like, oh, well, my doctor says that an issue with the pelvic floor is a female problem, and that's just not true. You guys have a pelvic floor as well, and if you have a pelvic floor, there is things that can go wrong in that area as well. So really, you know your body, and don't listen to someone telling you that that's a female problem, because that's really not true at all. There are plenty of men out there who have experienced some type of pelvic issue. Another function of the pelvic floor is to help with stability of our spine and our pelvis. So it's kind of made part of the core, and the core is like a general term. So I think different people have differing opinions on what muscles make up the core. But really the main muscles would be the deep ab muscles, the pelvic floor, and then our deep spine muscles. So they make up the core and they keep our spine stable. Keeping the spine stable is important in injury prevention. So since the pelvic floor is a group of muscles, they can experience issues just like any other muscle in the body can. The difference with the pelvic floor is based on the location and then the function of it working on stabilizing our organs. The symptoms of pelvic muscle dysfunction might be a little different than you would experience if, say, you like strained your low back or you strained a neck muscle. So symptoms that you might experience if you're having an issue with the pelvic floor, you might experience some type of pelvic pain. You may also experience issues related to urinary function, sexual function, and bowel function. So like any muscle, the pelvic floor muscles could be too tight or they can be too weak. I'm going to give you a general overview on symptoms you might experience if the muscles are too tight or if they're too weak, but keep this in mind, this is a general overview and it's not to say that this is the case for everyone. It's just the most common symptoms that are seen with weakness or tightness. So when the muscles get too weak and that sling is not as tight as we want it to and not supporting the organs as well, that's when we can get incontinence. So you might experience urine leakage, with some like activities like jumping, coughing, sneezing. You could also experience bowel incontinence with weak muscles as well. When the muscles become too tight, then we most commonly will experience some type of pelvic pain, or a lot of times from a urinary standpoint, you might experience urinary frequency, urinary urgency. And from a bowel standpoint, sometimes if the muscles are too tight, you might experience some type of constipation. So that's kind of a general overview. So just keep that in mind though, that everyone's different and it really is more complicated than that. And just because you're having urinary leakage does not mean that the muscles are definitely too weak, you might also have some tightness in it as well. And I might make another video on talking about Kegeling and should everyone Kegel, if you guys would be interested in that, because it's kind of a interesting perspective that everyone who has urinary leakage would think that they should Kegel, but it might not be true. So go ahead and let me know in the comments below. Okay guys, I'm gonna attempt to draw the pelvic floor. I do feel like I need to give you a warning. I'm literally horrible at drawing. My artistic ability is really, really bad, so I might regret this. But maybe it'll help the visual learners out there. Okay, so we're gonna draw the female pelvic floor first. So we're gonna have, this is our pubic bone, we'll say over here, okay? And then this is gonna be our coccyx, our tailbone. So you got your sacrum here, and then our vertebrae going up, okay? So you guys can orient yourselves. The pubic bone, if you're on your lower abdomen and you press down till you hit the bony part, that's your pubic bone, and then your tailbone is in the back, and then it starts to come up to the sacrum and the spine. Okay. So then we have muscles that make, it's even more difficult to draw like this. Jeez. Okay, so we have muscles that start to make this sling here. Okay. So these are our muscles here. This is the sling, okay? Then we have in the front, we have our bladder. So we're gonna say that's our bladder, and that's our urethra going down. So women, the uterus would be here, and it goes into the vaginal canal, and then we have the rectum back here. I feel like it didn't come out too bad. So these muscles are giving you support to all these organs. So you can see that if the muscles started to get too tight, then they would put extra pressure through the urethra and the bladder would be a little lower and on the bladder, and then you can maybe have some urinary urgency, frequency. If these muscles were too weak and they weren't supporting the bladder and the urethra enough, then you can see how you might get some urinary leakage. Again, if they're tight, you also might experience pelvic pain, but also this is, so from the uterus, then this is the vaginal canal, and you can see how the muscles kind of intersect the vaginal canal here. So when these muscles are too tight, then they can cause pain during sex for women, and pain during sex is not normal, and it does not need to happen. So if you are a woman who is having pain during sex, have it looked at, because you don't need to be suffering. It could just be tight muscles. Okay, so that's our female. Move that over. I don't even know if I want to draw the male. No, I do. I want to draw the male for you guys. Okay, so men. Let's do it again. We got our pubic bone. We have our tailbone, our coccyx, and we have our sling here of muscles. So similar to women, we have the bladder here, we have the rectum here, there's nothing in the middle, but then you do have the prostate that sits below the bladder. So the same thing can happen to men as to women in terms of the urinary function. So if this gets too tight and is pressing on the prostate and the bladder, you might have urinary frequency, urgency. If this is getting too weak, then you could have urine that would leak. So again, with urinary leaking, the muscles, just keep in mind, you can have tightness and weakness at the same time. So just because you're leaking urine doesn't mean that the muscles are only weak. So you can have tightness as well. The muscles are definitely more complicated than this. There are 3 layers of muscles in the pelvic floor. I'm definitely not drawing those muscles. I don't even think I could draw those muscles. And I can't really say I'm proud of these pictures, but I hope it helped you guys. Now, if you are experiencing any issues related to urine function, bowel, pelvic pain, your first step really should be to see a medical doctor. There are doctors out there who understand this stuff and who can help direct you on the right course of action, but you do want to be cleared medically and make sure nothing serious is going on, especially when it's related to urinary and bowel function. And when you're having pelvic pain, there's a lot of organs down there. We want to make sure nothing's going on with these organs. There's nothing going on actually medically, and that it is the muscles. So a doctor will be able to tell you that. Once you determine that it is the muscles that are causing your issue, the next step, you really should see a pelvic floor physical therapist. There are physical therapists that specialize in this area. Like I said, that's my specialty. And what we look at is we're really looking at what is going on with the muscles. So we kind of have a different perspective than the doctor might have. So a lot of times your doctor will clear you and be like, okay, nothing medically is going on, and they'll send, but they're not like trained to know. Some doctors are, but it's not many doctors like specialty to determine what's going on with the muscles. So your pelvic floor physical therapist will be able to tell you if the muscles are too tight, too weak, and they kind of will look at the whole body and see what's going on and be able to get you on the right track. So in the pelvic floor, we do have 3 layers of muscles. So we have a superficial layer, there's a layer in the middle, and then we have very deep muscles. So different muscles, it can be weak, can be tight. So your pelvic floor physical therapist will be able to assess all these layers and really get a good idea on what's going on. The great thing about working with a physical therapist is that they will get you on the path that you need to go on, and then you can start to work on these things at home, but at least you'll have a better guide and better idea of what you need to be doing. I hope this video helped answer your question, helped bring awareness to what the pelvic floor is, so you have a better idea on what's going on in your body. If you guys did like this kind of video and want me to do more videos going over some pelvic floor things, go ahead and let me know in the comments below. And if you have not already subscribed to my channel, please hit that subscribe button below. I hope you guys have a beautiful day.